It was really nice of you to provide a stool for this rather short person. So good morning, everyone. Thank you for having me today. I'm Mary Jo Byrne. I'm the director for the Fountain Clinic, which is your neighbor, like they said, right across the street. I was asked to give a little bit about the history of our clinic and what we're doing now. You're going to hear some very familiar names as I go through this history. It's been a very rich and rewarding, and believe it or not, it's going to be 35 years that we opened our doors to our clinic next May. The idea for the clinic started with Dr. Jim Marr. Most of you probably know him. He is now pretty much retired, but he still sees patients. But he came up with this idea 35 years ago of having folks that did not have insurance be seen by volunteer doctors in a clinic setting once a month. At that time, we did not have the Affordable Health Care Act, so there were no exchanges for people to go in and buy insurance if they didn't get it from work. Medicaid was extremely difficult to get. You had to be totally disabled to get it. So we had a lot of people that just didn't, for no reason that they just did not have insurance. It was surprising to all of us, I think, including me, who was the social worker at Oaklawn at the time, how many folks that we had that were in this situation. We opened our doors on May 6th of 1992. I thought then Bill Clinton was running for president. He had a platform that included national health care. I thought, well, we'll open this clinic, 2 years we'll be done. Well, here we are, 35 years later, we're not done. We still have a lot of folks that we see. Our first clinic was over at the Tanner House. Those of you that remember where the parking ramp is right now, there was an older home that Oaklawn owned. They leased it to the health department. The health department was run by Joe Carver at the time, and he really felt we needed this clinic, so he gave us free space to open our clinic. We had 445 patients that first year that we opened. Now we're seeing upwards about close to 3,000 patient visits a year in our clinic. We went from the Tanner House over to the Brooks House with the health department. And then at that time, we had Sally Bulgarelli as our director, and she said, we have got to have our own space. And by some miracle, Dr. Burris, Frank Burris, one of your parishioners, had decided to retire, and he wanted us to buy his building. He had other offers and really nice ones, but he felt that this would be a good spot for the clinic, and it was, because we were just 2 blocks from Oaklawn, so it was perfect. So we, I think Mrs. Jane DeGraw led the capital campaign. We raised the money, and we were able to buy the clinic from him. So that has been our home ever since. We offer several services over at the clinic. The number one, primary medical care. We are open from 8 to 4, 5 days a week. We have 2 nurse practitioners that see patients, 2 RNs. We have a dental hygienist that does our dental work, and then we have 3 support staff. The medical portion has decreased a little with the Affordable Health Care Act, but it is going back up again. When we lost the insurance subsidies for that in January, folks were losing their insurance. So we're seeing more patients on the medical side. Dental has been huge. So many folks that might have health care, medical care, can't afford dental insurance. So our hygienist is busy 4 days a week seeing patients. And because we have a special license, she can do cleanings and screenings at the clinic without a dentist being there. Our dental director is Dr. Dave Heidenreich. He oversees our program, but our hygienist does most of the cleanings and screenings right in our building. If they need further work, we have relationships with about 5 other dentists that we can send the patients to. They can get their fillings or their extractions. We negotiate a price of 40% that we pay for, and the doctor is willing to give us the rest as a charity donation. Up until about 2 years ago, the one piece we just could not seem to put together was mental health, and we needed it. So many of our patients really needed mental health services. We could send them to Summit Point, the county mental health program, but they could only go into group counseling, and so many of them just refused to do that. So we were fortunate to have Derek Allen come onto our board about 2 years ago. He's the vice president of Star Commonwealth. And he said, I think I can help you. They have counselors, particularly on the east side of the state, that will do virtual counseling. And we were able to get that for our patients. We pay for it at, again, a reduced rate, but at least we were able to get it, and it has been very successful. We're really grateful to have it. The one service we offer that really isn't medical, but it is become a real necessary part of our work is we have a trained certification application counselor, it's called, who can help people apply for Medicaid and also can help people go into the exchanges and get insurance. That has been invaluable for so many folks, particularly right now as they may be losing their insurance. Getting into those programs is quite complicated. And Maureen, the person that we have that's trained for that, is excellent. Oaklawn sends their patients to us that don't have insurance, and she does a great job of doing what she can to get them coverage. We are also the fiduciaries for the senior millage program for both prescription and dental. For folks over 60 whose income qualifies, we're the ones that get people qualified and get them into the dentist and also help them with their prescriptions. We've been so blessed over the years. I've been director for almost 20 years now. And I can honestly tell you, there was a time about 2 or 3 years before after I took over, that I thought I'd have to go to our board and say, we can't do this anymore. It's just too expensive. We don't have the money. We just have to close the doors. And then we received a miraculous donation from a woman that Dr. Marr cared for many, many years ago, that gave us the stability that we'll be able to go on for many, many years, way past my lifetime anyway. And so to give back to the community, we try to do a few things to show our appreciation for everything that's done for us. We do monthly blood pressure and blood sugar testing for anyone in the community on the first Friday of the month between 9 and 11. We've been doing those for about 19 years. If you feel like your blood pressure's been giving you issues and your doctor's after you to cut back on your salt and you want to just kind of monitor it, just come in. It's free. We have an RN doing it. It takes a few minutes, and we're happy to do it for you. We also do a flu shot clinic. We'll be doing that in October. We attend a lot of senior health fairs and do blood pressures there, and we're happy to do that. And then last year, we started a collaboration with Oaklawn and Hemingson's for National Diabetic Day. Diabetes is almost a pandemic, or at least an epidemic in this country. So we were trying to do our part to do screenings, foot checks, A1C, blood sugar testing, and also education on that day. And that is on November 13th, I think, this year. You'll be seeing more information about it. It was very successful last year. So how do we do all of this? Some days I'm not quite sure, but we do a lot of grant writing. The foundations in this community have been very generous. The Cronin Foundation, Marshall Community Foundation, Rotary, they've all been very generous to us over the years. We also have a grant from Blue Cross and Blue Shield, and also a small check from the state of Michigan. We made it, well, Dr. Marr made a decision way back when, 35 years ago, not to take any federal money. So we do not apply for any federal grants, which I'm glad he made that decision 35 years ago with some of the issues that we're seeing right now. So we've been able to hold our own, and like I said, we've been very blessed over the years. The other thing we do are a lot of fundraisers, and you probably all see them all on Facebook, but they keep us going, and we appreciate it. And we also appreciate the community support, the support we received from your church over the years. It's been incredible, and I can't say enough about how this little clinic has done so well in such a small town, but how this community has been able to keep us going for 35 years. And not only us, but you keep Max going and you keep Mobile Meals going. In a town of 7,000, metropolitans 10,000 maybe, that's incredible to keep three organizations going that take care of people. So you're doing God's work, and I thank you for it, and thank you for inviting me. Now to get down.